everyone to the relaunch of the African American Community Health Equity Council. Yes. And so AACHEC at its height had 100 organizations that were part of this movement. Amazing. And so we're relaunching today because it is time. We are not going to be eradicated from San Francisco, right? Can we say that? Black people are not going to disappear from San Francisco. I'm an SF native.
This coalition is really a coming together of organizations and leaders that have always stepped up to serve and spoken up for our communities.
Race issue is a huge issue in America. And I realized that, wow, how come it's always about the colors? How come we have to say this is people of color? We're just people. We just have needs. We just have, different needs in the community.
There ought to be efforts to sustain the Black community in San Francisco. And there ought to be efforts to actually invite folks back to San Francisco who, for many reasons, including economic reasons, have had to leave the city, forced out of the city, priced out of the city. And if we're going to change that, then that's only going to happen with intention.
But when we're talking about defining health and well-being, we're talking about having access to quality and effective culturally responsive care. And this includes music and movement and self-love and trauma-responsive services and programs integrated into everything that we do.
We have always been locked out of resources, which is one of the reasons why so many Black Wall Streets, like our organization and Black business efforts across the country have come together, because we've always had an issue with getting access to those resources.
And we are at a crossroads, and this is about multicultural solidarity, because that's how we win. That is how we win. Not being separated, no divide and conquer. We're coming together. Black, brown, Asian, we're coming together. The data is there. We don't need to do another study. We don't need to do more research. The data is clear. So what else are we going to do to get the city to act when we know the data is right there and it's been there for years? So that's what we're doing with AACHEC. I would love for everyone to be part of what we're doing, because the time is now.